Okay, welcome to our webinar today, Building Routines, Rituals, and Resilience in a Hybrid Workspace. So this is the second topic that we're going to cover around hybrid work, and it's actually the third in our Spotlight on COVID-19 Recovery webinar series. So I'm Julia Kujava, and I'm one of the managers of knowledge mobilization at the Knowledge Institute on Child and Youth Mental Health and Addictions. And I will be facilitating the session today. Today's session is in collaboration with Children's Mental Health Ontario. And as I mentioned, is part of our Spotlight on COVID-19 Recovery webinar series. So you'll see in the next slide in the agenda, we are starting with some opening remarks that Tatum Wilson will be presenting. And then we're going to move on to a few housekeeping items, the panelist presentations, and then the focused discussion with plenty of time for Q&A, as well as wrap up, which is just a few reminders for you and exciting updates about what's coming next as well. So I'd like to now give a warm welcome to Tatum Wilson. Tatum joins us as the CEO of Children's Mental Health Ontario, and he's worked in the health and social policy environment for over 20 years. Tatum is a passionate promoter of equity and social justice, and he's overseen the first comprehensive mental health and addiction strategy, as well as managed Ontario's first poverty reduction strategy. So I'm now going to turn it over to Tatum.
Thank you so much, Julia, and a big welcome to everyone, and thank you for joining us today for the webinar called Building Routines, Rituals, and Resilience in a Hybrid Workspace. Just note that we are recording the webinar and there will be a copy available of it after it's complete. As said, I'm Tatum Wilson. I'm the relatively new CEO of Children's Mental Health Ontario, and I'm really pleased to be here today, and especially thankful for the being able to co-host this webinar in partnership with the Knowledge Institute on Child and Youth Mental Health and Addictions. Before we do get started today, I would like to offer a land acknowledgement. We would like to acknowledge that we are joining from across Ontario on land that has been inhabited by Indigenous peoples from the beginning. As settlers, we're grateful for the opportunity to meet here, and we thank all the generations of people who have taken care of this land for thousands of years. We recognize that Indigenous practices of health and well-being have been in place in this territory for over 10,000 years and are maintained to this day. As healthcare leaders, we have much work to do ourselves to do our part and support the decolonization of the children's healthcare system. And with that, I would also just leave you to consider your own thoughts on what the land acknowledgement and acknowledging the land that you are on means to you as we move forward. In May, we did already host the webinar jointly brought to you about leading in hybrid workspaces, because we know that the COVID-19 pandemic has changed so much about all of our day-to-day lives, ways of doing, our routines and practices, and especially including how we work. And together we actually have learned a whole lot, jumping to virtual care during a period of crisis, adapting to changing directives and guidance in your day-to-day operations, and up until today where we find ourselves in the midst of a recovery of sorts, continuing in our collective hybrid journey together. As we move and shift in this new world, we're not only collectively asking ourselves what we need to do to get through it, but also what we need to do to thrive. And what have we learned and what should we be considering next? I'm really excited about today's panel because we're going to explore just those questions and learn from the literature and best practice. For example, how can developing routines and rituals meet the needs of your diverse teams to improve team culture and build healthy workplaces and workforces? And how can that in turn best support children and young people and families we serve? Thank you again so much for attending today. And like you, I'm really looking forward to hearing from panelists and learning more. And we always find that particularly the questions and answers are particularly helpful in this. So looking forward to everyone's participation. Thank you so much, and we'll turn it back over.
Wonderful, thank you, Tatum. So we're just gonna go over, as I mentioned, a few housekeeping notes. So throughout the session, we do encourage you to submit questions using the Q&A tool. So you'll see that at the bottom of your screen, and we will actually collect these and we'll share them back out during the facilitated question and answer period at the end of the session. So we've reserved some time for that today. And the other thing that you can do, you can certainly upvote questions as well. And just by upvoting questions, that gives us a sense of which questions you're most interested in hearing about. In terms of other pieces, we do have the chat function as well. And so we encourage you to jot down any reflections, insights, or comments throughout to make the most of our time together. If you do have any technical issues, we're here to help. And we've placed a team member's name on the slide as well as in the chat box. The other piece I had mentioned in the comments was just around the live captioning. So unfortunately, we don't have live captioning at this time, but we'll make sure that the slides are available and the recordings are available so everyone can benefit, and we'll look into live captioning for next time. Thanks everyone, and we hope you enjoy the session. I'm now going to introduce our first panelist, Poppy DeClouds. So Poppy is a senior researcher here at the Knowledge Institute, and she's also a mental performance consultant with expertise in applied performance psychology and well-being. She's going to present the latest research evidence on the topic. Take it away, Poppy.
Thanks, Julia. And hi, everyone. It's really a pleasure to be a part of this conversation today. I have the privilege of introducing this topic of resilience and contextualizing it in our current landscape. As we move forward from crisis response during the pandemic to recovery, we know hybrid work has really become an ongoing practice for all of us. Resilience is top of mind because we're navigating our new normal and our new work lives. And I'm not sure if I can advance slides. There we go. I'm just getting on top of my tech. Okay. So resilience itself has many definitions and conceptualizations, but much of our understanding of resilience is actually rooted in research on populations that have had to be resilient in the face of unforeseen adversity, conflict, and crisis. This is the kind of resilience we tend to think of when we're considering the COVID-19 pandemic. We had to adjust to adversity, and we had to muster up our sense of control. However, resilience is not a one-time reaction or a one-time response. It is a skill, it is a trait, it is a process, a proactive strategy, and an outcome. Resilience might be seen in what an organization does to adapt, how they adapt, the amount of challenge and change they can manage and overcome, and even how they sustain adaptability over time. As we move from surviving the pandemic into thriving in our new modes of hybrid work, it's really important that we start thinking beyond just bouncing back. We can instead start to consider resilience as something that can be fostered and improved over time at both individual and organizational levels. Rebound resilience is this thing that we refer to returning quickly from temporary disruptions. It's a quick return to our optimal functioning. Robust resilience, on the other hand, is when a person or an organization maintains their well-being and their performance under pressure. It's sustainable. We need both, and we can foster both, but we tend to focus on the rebound resilience, just getting over things. Robust resilience is about the gritty long-term work. It's grown from trial and error, from making mistakes, and from learning. It's about moving through stress and getting well acquainted with challenge. I look at resilience as the ability to learn from and return to challenge without putting our values or our well-being at risk. So resilience in its Latin roots refers to leaping back, but this doesn't actually encompass all of what resilience is, and unfortunately it has created misconceptions about what resilience looks like. Resilience is not toughness, nor is it an innate psychological edge. It's also not about being stoic or denying our emotions, our pain, or our difficulties. It's not about leaping back before we are ready to do so. A lot has to happen before we make an optimal return. This is important because the impact of the COVID-19 pandemic among mental health and addictions workforces has included higher rates of stress, burnout, fatigue, and substance use. The pandemic introduced additional work stressors that we're all well acquainted with, which ended up dysregulating our stress response. Some of these stressors included confrontation of systemic racism and inequities in the workplace, disillusion of boundaries, privacy concerns, and blending of our work-life environments. The stressor categories I've listed on this slide, novelty, unpredictability, threat to ego, sense of control, are by Dr. Sonia Lupin from the Center for Studies on Human Stress. They're usually considered one or two at a time to pinpoint a catalyst of a stress response. The pandemic had us facing all of these almost daily. It's no wonder then that the pandemic instigated a perpetual state of heightened alert, which over time can actually lead to illness and poor mental health. Hybrid work has us facing this same list of stressors because now we have been thrust into a perpetual state of change. Despite hybrid work offering increased flexibility and increased autonomy, workers are reporting being exhausted from hybrid models. This is because constant change, things like flipping between our office and our home, having different work hours, different work environments, different work days, can chip away at our cognitive and our regulatory resources. Hybrid isn't second nature for us yet, so it takes a lot of extra focus, planning, thought, and self-regulation to execute it well. So in knowing this, what can we do now to start moving out of our crisis response and into a place where we can sustain resilience and move through these stressors well? Luckily, in performance domain, challenge and change is really commonplace. Research in this area focuses on those who actively seek challenge and thrive under pressure. So what have we learned? Those teams and individuals who are masters of the unknown and thrive in complex, challenging environments are first and foremost committed to the challenge zone. They actively seek to move just beyond what is comfortable every single day because they know this is where positive change occurs. They cognitively appraise challenge differently. They embrace the experience of failure, track progress, work with intention, rest and recover purposefully, constantly develop self-awareness, recognize and embrace a full spectrum of emotional experiences, practice self-compassion, share common experiences, and they use their support networks. Hybrid is an ever-evolving model that demands trying new things, making mistakes, and adapting. And this is where challenge mindset and this challenge zone are really all about. Challenge mindset is about actively seeking challenge on a routine basis so it becomes normal rather than stressful. And this is really hard in a post-pandemic hybrid environment. In a state of high alert and stress, our brains tend to default to what we know best, what we know we do well, and whatever keeps us from failing. Embracing challenge can seem counterintuitive. So resilience in our landscape now is a long-term investment about building new patterns. It's not the avoidance of stress, but the ability to move through it. Each time we face adversity, we can build resilience, but we need to be provided with the right tools and the right environment. Researchers, Drs. David Fletcher and Mustafa Sarkar have developed evidence that resilience relies on the intersection of personal qualities, challenge mindset, and a facilitative environment. Personal qualities of each person will change what skills need to be leveraged in order to optimize their resilience. These skills can look like implementing reliable routines to manage our energy, our mindset, our focus, and to reduce uncertainty. Practicing task switching instead of multitasking. Modeling self-regulation through shared reflection practices and goal setting. The collective skills and qualities of our staff will actually contribute to the organization's ability to thrive and move through challenge. This means organizations require cognitive resilience, building skills, habits, and routines that foster behavioral resilience, the ability to identify and respond to challenge in a productive way. All of this is grounded in a resilience facilitative environment. This is Fletcher and Sarkar's challenge support matrix for developing resilience. It underscores an ideal environment for sustained resilience. This is a space that welcomes trial and error, where staff feel accountable for their actions in a way that they can be open about and are not alone in experiencing. This is an environment of high challenge, high support. The model also clarifies pitfalls of other combinations, two of which have been amplified by hybrid work. The first is low challenge, high support, which leaves us in the comfort zone, unable to try new things, unable to grow, and unable to develop self-efficacy. The second is the environment of high challenge, low support. This leads to an unrelenting environment where we see things like burnout, isolation, and even emotional abuse. The reason we need this matrix in the hybrid workplace is so we can increase our awareness of the optimal balance and so we can get it right. If we want to begin growing and thriving, the literature shows us that we need to create opportunities for challenge, and we need to meet these challenges with optimal support. That means social support, instrumental support, and informational support. In some organizations, this could mean more support is needed right now because staff are burnt out and fragmented, not used to the online environment. In other organizations, this could mean it's time to introduce challenges and skill building because staff are unmotivated and looking for something new. When it comes down to it, a resilience facilitative environment is based on challenge that is posed consistently and incrementally with appropriate supports. There is no throwing people into the ocean to see if they can swim. Clarity and transparency are paramount, so we don't add to uncertainty. And so things that are within our control are actually controlled, like clear expectations, clear feedback, clear roles, and clear responsibilities. Planning and routines underpin the work structure of these environments because planning and routine can help us feel confident through preparation, reliability, and accountability. Finally, mistakes and obstacles are highlighted as part of progress. Space, time, and attention are given to challenges and hiccups, and they're acknowledged as essential to our growth. That's it for me today. Thanks so much for being here. I'll pass it back to you, Julia.
Thank you, Poppy. That was great and a great introduction to our topic today. Okay, so our next speaker is Greg Lubymiv. Greg is the Associate Executive Director at the Phoenix Center for Children and Families, and he has over 40 years of experience in children's mental health, adult mental health, and child welfare. Greg has expertise in therapeutic storytelling, trauma, reflective practice, and temperament. And we are pleased today to have Greg share with us his experiences at the Phoenix Center. So Greg has pre-recorded his talk today, and then he's going to join us live for the focus discussion and for the Q&A portion. So we're pleased to now share with you Greg's conversation about the Phoenix Center's experience with resilience during this hybrid workspace.
Good afternoon. It's a pleasure to be here with you to share with you the strategies and experiences that the Phoenix Center went through in supporting our staff during and now in the post-pandemic, or hopefully the post-pandemic phase of COVID-19. To give you some context, the Phoenix Center is lead agency for Renfrew County. We're the only core service provider in this county, and we provide all services except for residential. We're the largest county in Ontario. A large municipality is 16,000 population, and we have about 40 FTEs. When we entered into the world of the pandemic, we quickly tried to identify what are the areas we need to pay attention to. And we did this both in the agency and collectively with a group of agencies that had formed in the Champlain region to try and work together and collaborate to share information, knowledge, and resources. And the ones that we identified internally were health and safety protocols and materials, tools, especially equipment and connectivity, virtual platforms and digital solutions, training, practice changes, and communication. Our primary area to focus on was health and safety. And we did follow the protocols that were based on information coming from Health Canada and our local public health unit, as well as from Ontario Health and CSS. This led to us ensuring that safety equipment was available both on site for our staff, but also sending home to staff to ensure that they had the right resources. And this included masks, sanitizers, disinfectants, plexiglass screens, etc. Best practice in terms of hand washing, proper use of masks, and there were some great online videos that were available to share with staff that they could really get a what is the best practice understanding. We also provided staff, as an example, with an extra week holiday during Christmas break, with one half taking that before the Christmas and one half after the Christmas break, in recognition for the additional stress and strain that was being put on staff because of COVID and on their families. There was a great advantage in most of our system where we did have access to special COVID funds from Ontario Health or MCCSS, as well as from some other sources like United Way or our local town. This provided us with the ability to ensure that all staff had their home offices in place to do out-of-office work. And this included ensuring all staff had laptops, and we did include not just our clinical staff, but our min staff and our management. Furnishings for home offices, desks. We actually found a great deal for executive chairs that were heated and had massage units in them. And that was provided to all staff. The regular chairs, room dividers, monitors, anti-glare screens, et cetera, et cetera. So we were very quickly able to ensure that all staff had the right equipment and tools available. Smartphones and plans were provided to all clinical staff to allow for private connection. We did realize, probably not right away, but within the next few months of starting our offsite or in-home sessions, that we needed to make sure that we were responding to clients, not just with video, but also with texting and with phone. And a large number were actually preferring just phone. Connectivity, we reimbursed staff for 50% of connectivity fees in the last 2 years. That will probably be a little bit less this year as additional monies are not as large in our availability. And we also recommended that staff, especially because we're in a lot of rural areas, increase their gigabytes to try and create more stability for their connections. They were provided with other types of things like goosenecks and webcams for use in virtual treatment of clients that provided them with extra options to make their sessions a little more either interactive or interesting. And we were aware in Renfrew County that virtual care could be a barrier for clients, and some of our staff are quite stressed about, what are we going to do around clients who don't have access? And we were part of a United Way Fund and a collective in the Champlain area where we had funding, and Phoenix Center hosted the provision of virtual care equipment, technology, connectivity to clients who were accessing mental health, addiction, and substance use health services or wellness services. And we also had some resources to help some of the small agencies in the same way. Our first endeavor was to figure out what to use as a platform, and there were several that were available, and we started to examine On Call, Microsoft Teams, OTN, Zoom, Doxy.me. We started with Doxy and Zoom, but very quickly the feedback was that Zoom was more reliable because of our large rural area. Needed the lowest bandwidth. It was also very easy to use and to orient to, and clients also found it quite easy to use. And so we did end up using Zoom as our main platform with all of our clinical staff and management staff having accounts to utilize that. It is one of the more costly ones. So as we move into the new world of hybrid model, we are examining what those other options are, because there have been lots of improvements in the platforms of others, and there may be some other solutions that are more efficient in terms of cost. We also incorporated a client automatic reminder system so that staff didn't have to worry about checking in with clients and make sure they, especially youth, that they would not forget about a session that they had, and that took that weight off and actually decreased the numbers of no-shows and cancellations that we were experiencing pre-COVID. And that's something we'll continue to use in our both in-office and our virtual session work. Training, we provided staff online training to support all their regular training needs in single session therapy, CBT, DDP, et cetera. We also were able to provide staff with a special session on engaging virtual care work using different tools and playful activities and strategies so that it would be more fun, engaging, in particular for children. We also provided training on using talk sessions without video, so using the phone and some of the strategies and thinking that you would use to make that and incorporate it into the work in effective ways. And we provided training around things like confidentiality and how to manage that online. So as an example, if we were doing a video call with someone and a youth who's 15 and they lost their privacy, parent came in the room, but they didn't want to say anything, they would just touch their ear, and that was a sign that the therapist would know someone was in the room and they should really change the conversation. And then when they touched their nose or their mouth, then it meant that it was all clear and they could talk again. We identified other types of practice changes that would make it more manageable, less stressful for workers. We reduced client contacts per day. It was usually about 5. That was our average for staff for up to 4 days a week. And we moved that to 3 or 4 sessions per day. Ask them to space out their clinical work. So try to avoid that back-to-back, 2 to 3 and 3 to 4 and 4 to 5. And also try and change those mediums. If they had a phone conversation with a client, try and do that next to a video conversation. And don't use video for all discussions with, for example, consultation, supervision, because it's just a different break from that video screen. Reduce session times, 30 minutes for younger children, 45 for youth and adults, take more frequent breaks, connect with consultation as needed. We also, in communication, we implemented the weekly huddle to keep everyone up to date on what was happening, P&P issues, information that we thought would be important for staff, new policies, procedures, and that staff found really helpful to stay connected and with each other, but also with the stress of the unknown, that we tried to really reduce that. In the second year, staff were feeling that we didn't need as frequent. We went to monthly, and in the last 9 months, staff actually said they didn't need them anymore. But interestingly, after 3 months of not meeting, they came back and said, we actually are missing that. We like to have that updating and that huddle. Also in communication, we made sure the staff received communication that came through to us from Public Health, Ontario Health, MCCSS, Health Canada, again, to keep them in the loop of whatever we knew the staff were aware of. And in the hybrid model, we're looking at reconnecting with staff now, in-person teams, staff board events. We have a staff barbecue planned, a Christmas party that's coming up. We had a fun team implemented for the last 10 years, and they're now re-engaged to look at trying to find different events, raffles, puzzle, trivia games that we can bring staff together both online and in person to just have some fun and reconnect with each other. And we're exploring strategies for that recruitment, retention, and creating a culture of wellness and support ongoing, which need to continue to use all those different areas, making sure we're providing the training, making sure we're taking care of the wellness of staff. We are still concerned about staff being really a bit burnt out around the use of in-person as they come back to the office, and that blended model of some in office and some at home, how we can help them find that balance and make sure that they are proceeding. And part of that is a communication of being open to issues that they might have, problems they might have, and looking at the mitigation of that in a quick and effective manner. So that's packing a lot in a short period of time. There's many more things that were involved in that journey, but these were the main highlights. And hopefully that's helpful to you, and very pleased to respond to any questions or comments later on.
Okay, thank you for a great talk by Greg. We're now going to move to introduce our next speaker. And one of my reflections was, how can we make the case for our organization that we too need some massage chairs? So it's my lighthearted bit. I really loved all of Greg's ideas that they'd implemented at the Phoenix Center. So next up, we have Ali Grovu, and she's a senior consultant at Ignite Management. They're a consultancy agency that facilitates strategy and leadership development. And Ali's an expert in organizational strategy and leadership development. She served in a variety of roles, including executive director of a nonprofit organization, as well as an officer in the Royal Canadian Navy. Over to you now, Ali.
Hi, everyone. It is fantastic to be here. Thank you so much for the invitation. I've really enjoyed the presentations so far. I've got a lot out of it as well, and madly taking notes. So we'll be looking forward to the Q&A. Like Greg, I also am attempting to pack a lot into a short period of time. I'm going to talk a bit about the business perspective on organizational resilience. We do work with nonprofits, government agencies, regulators, associations, but probably about half of our business is with private industry. I'm going to see if I know how to advance my slides. Yes, I do. Look at me go. I'm going to cover 4 topics briefly, and then look forward to digging in wherever you would like to dig in when we get to the Q&A. I'm going to talk briefly about the business landscape. I'm going to speak about organizational resilience from our perspective, what it is and how we build it. And you're going to see a lot of parallels and connections with Poppy's presentation. I'm going to speak a bit about building trust because for us, this is one of the key components of building organizational resilience. So I'll spend a little bit of time there and provide some considerations for you all. And then I'll share a few hybrid considerations. And there, I think you'll see some parallels with some of the considerations that Greg offered as well. So that's great to see that there's a connection between all of that. Business landscape. So I'm going to talk very briefly about what's happening in the business community, just to provide some context, but it's really, I suspect it's very similar to, if not the same as really what you all have been faced with, at least at a high level. So our topic today, we're really focused on organizational resilience, but what's happening at the individual level is so critical to understanding where we are and what we need to do or get right as leaders. We heard this from Poppy's presentation. At an individual level, we're seeing higher levels of exhaustion and anxiety in the workforce than ever before, and reduced resiliency. And there are a number of factors. I've captured a few here. Increased isolation, there's a lack of connection, people being more isolated, working from home, not having that sense of belonging and community and human connection or personal connection with their colleagues. And for some folks, still having less engagement with friends and family as well. And certainly over the early part of the pandemic, that was true. Seeing reduced vitality or health, so really a lack of healthy routines. This isn't true for every single individual, but overall we see people with the burdens that they're carrying, they're reducing the healthy routines that help to build their resilience. Another piece that Poppy touched on as well is reduced cognitive functioning. People are just overloaded. You probably feel this yourself at times, but you also see it in meetings. People lose focus, they lose time, they get distracted. The high degree of stress, the overload, the meeting overload, people continuing to take on more and more, both at home and at work, we're all cognitively overloaded. So all of these things, they impact individual well-being, but they also impact business performance. So when we take this back up to the organizational level, at the team and organizational level, there's additional factors. So reduced collaboration. There's a lot of debate about whether people are as effective working from home or working remotely. There was a great study over the pandemic, which we can send the link out to as part of the resources by Boston Consulting Group. It was a study of 12,000 professionals in the United States. And it found that while most people were at least as productive at home on individual tasks, only 50% found that they were as productive on collaborative work. Some employees have roles that are largely independent, but for the rest of us, and I argue for most of us in the type of work that we do, the speed and effectiveness of in-person communication, it positively impacts collaborative work. And in this study, this was according to employees. This is not employers trying to make the argument. This is employees acknowledging we're not as productive, we don't do as well when the work requires team collaboration and communication. So work from home, remote work, it does impact collaboration. This also feeds into people's sense of connection and belonging, and it does have an impact on organizational culture. A couple other here, new routines. So at a team and organizational level, you're adapting to new ways of doing things, which is continues to challenge us. And there's ongoing macro disruption. So there's business closures, changing health protocols, a significant supply chain disruption, which has been a big factor, certainly in the private industry and may or may not affect the work that you folks do. So you have exhausted leaders, they're leading an exhausted workforce who need to not only continue to perform, but continue to perform under ongoing change and disruptions. This is a really, really tough time to lead. It's really challenging to our resilience, both as individuals, but also at the team and organizational level. So what is organizational resilience? We heard some great definitions and constructs from Poppy. So what does it really look like for an organization to be resilient? This is a definition. Organizational resilience is the ability to anticipate, prepare for, respond, and adapt to incremental change and sudden disruption to survive and prosper. There's two pieces here that I think are worth calling out. The ability to anticipate and prepare for. So this is about that ongoing investment in resilience. It's not about what you do in a crisis. It's what you do long-term to build resilience in your organization so that you're keeping up with change and that you're able to respond well when there is disruption and difficulties. The other piece is this incremental change. This isn't just about crisis response. This is about the world keeps changing. Our environments keep changing. That is never going to stop. So how do we anticipate, prepare for, respond, not only to disruption and crisis, but to the normal incremental change? We saw over COVID, a lot of businesses realized we have been complacent. And it was COVID that brought some things to their attention of where they had fallen behind because they had not been keeping up even with the incremental change over the years prior to the pandemic. So how do we build it? These are the organizations that do this well. What is it about their leaders or their culture or their processes and systems that enable this resiliency? There's a theme here. I want you to think about this as putting in place ongoing sustainable practices and behaviors. This isn't about a one-time thing or something you need to do now or something that you should have done during the pandemic. It's about how do we build and maintain resilience long-term, no matter what comes our way. It is potentially a long-term shift in how you lead your organization. It's that ongoing investment or that creating that robust resilience that Poppy spoke to. And if there's similarities between what you need to do to build individual resilience and organizational resilience. So a lot of the points that Poppy made, I think apply really well also to building organizational resilience. Two key categories: building strategic discipline as an organization and building resilient leadership habits, which then create resiliency in your organization. And on the leadership habits, these are the organization can have an impact in doing that, and individual leaders can also take that on themselves. I'm going to focus on the leadership habits piece. In our work with organizations across Canada, we've identified 6 leadership habits that differentiate really high-performing, resilient organizations from others. Optimism, courage, humility, inquisitiveness, trust, and discipline. I think I only did 5. Discipline out of order. What we found is you need to be working on all of them, but trust is so critical to building resilience and ties into psychological safety and what people need to grow, thrive, and respond well to change and challenge. So I'm going to spend just a couple of minutes on how can we build trust? What does that look like? And what might we focus on, particularly as leaders, to help build resiliency in our people and in our organization? There's lots of great research and support for the importance of trust in building resilience and in building high performance teams. Depending on what you read, you might see 3 C's, you might see 4, you might see 5. This is the long list that we use: character, competence, consistency, communication, and care. And as you need all the research shows that you need all of these to have high trust relationships with your people and with your peers. But it also shows that care has the greatest impact on the trust that you have with your people. So what concrete actions can we take to build trust? It's not as complicated as we might think. This is about small actions that we can take as leaders and take consistently. So here are some suggestions. This isn't everything, but these are some foundational ones that frankly most leaders don't do. So if you can start here and encourage leaders in your organization to do so as well, you can really have a big impact. So you'll see that 3 of the 5 are focused on demonstrating care. The first one, ask employees, how are you doing? This is, if you're in person, it's asking this when you walk by, asking them, how are you feeling? How are you really feeling? How was your weekend? Every single time that you talk to them, it takes a couple of minutes. It demonstrates that you care. It slowly builds trust over time. And it also gives you a pulse check on how your folks are doing. These all apply. I'll speak about hybrid considerations, but these all apply whether you're in person or virtual. Tell employees thank you every single day. Show your appreciation. Tell your employees what they're doing well and what they're not. Caring is showing up every day, asking how people are doing, thanking them. It's also telling them what they're doing well and telling them what they're not when their work isn't good enough. High standards creates trust and respect. People will trust and respect you as a leader if you have high standards. We saw a big swing during COVID where leaders, and this would be the words that they have used with me, where they swung too far to compassion, or I was too nice. And with a translation of the erring on the side of compassion for a lot of people was lack of accountability. So there was a big swing there, and it actually, in some cases, actually diminished trust. And I'll speak a little bit more about that. Telling employees as much as possible. So transparently share information. Over communicate. Transparency builds trust. Don't make them wonder. Don't make them wonder what the strategy is. Don't make them wonder what you expect of them. Don't make them wonder what you're thinking. Don't make them wonder what they're doing well and what they're not. Don't make them wonder if you care about them. So really that high degree of active communication is super critical for you as a leader. The last one is a bit personal. Ask yourself, am I showing up consistently? Who do you need to show up for, and how do you need to show up? Someone shared with me recently that they're really struggling at work because when they walk into their boss's office, they don't know what they're going to get. They don't know what impact. Even a small look on your face that may not seem big to you is big to them. So they're really going to feel it. So you really need to monitor your own emotions and how you're showing up, and do all of these things, whether you are virtual or in person. I'll quickly just cover my last, I think this is my last slide, some hybrid considerations. The first is guiding principles over policies. You may need policies, you may not. Either way, you should have some guiding principles. What are the principles that you can speak about as a leadership team that will help to guide the decisions that we make about work from home and hybrid work? What are the strategic pursuits that will guide us? Because this will help you help employees make decisions, or if you have policies in place, it will help provide the foundation or rationale or why behind the policies that you put in place. Consider impact on collaboration and culture. I spoke about this before. I know it's a bit of an unpopular stance, but work from home does have an impact on collaboration and culture. If you do go fully virtual, the best way to replicate it, short, frequent meetings, more huddles, it can create a higher meeting burden. But if there's offsetting increase in individual productivity, then you may have a balance there. Building trust is the same in person and virtually. Don't let yourself off the hook. Thanking people every day, asking them how they are, sharing information. You have to be more intentional about it virtually, but you can't use virtual as an excuse not to do it. So all those same suggestions you need to be doing virtually as well. There's an old management construct, management by walking around in a virtual environment, management by making quick phone calls, sending a message, use all of the tools at your disposal to be there for your folks. The last one, draw a hard line on meeting overload. We saw some great examples from Greg on what they did there. Ask yourself, what's the maximum number of meetings or hours a person should spend in meetings a day? What's healthy? Not suggesting that the leader needs to be the meeting police, but you set the example. You need to make it okay to say no. You need to make it okay to say I'm not available. You need to make it okay to say I can't do back-to-back meetings. Why are we accepting back-to-back meetings? And there's the example Greg gave in terms of client care, but in regular meetings, internal, whatever it is, why are we accepting that and taking a really hard look at it? If you keep hearing, no, I can't, and people setting those boundaries because they are over capacity from a meeting overload perspective, it means you're over capacity as an organization, and you need to take a hard look at what you're doing, how you're resourced, the volume of work you're taking on, and that goes back up to the strategic discipline. So in conclusion, understand what resiliency looks like, but more than anything, identify some small actions. Don't worry about everything that you've heard today. Pick one small action, start doing it and do it consistently. And if all of your leaders do the same thing, you will build resiliency over time. I look forward to the Q&A. Thank you so much.
Thank you, Ali. I thought you had some really relevant points within there, and then just ending off on, don't worry about implementing all of these at once. Take one or take a few strategies, kind of start slow, and then you can learn from those experiences with your organization. So thank you to all of our panelists for sharing their insights. We're now going to move into the focus discussion, and then from the focus discussion, we'll move right into the Q&A. So now is your time as we're heading through this focus discussion bit to keep submitting your questions. We definitely have some flowing in through the Q&A tool, but if you have additional questions, please add them to the Q&A because we'll have plenty of time to discuss those. Okay, so we're going to move into focus discussion so we can stop slide sharing to see all of our panelists. Great. So we have a number of questions for you today. And the way these questions work is that anyone can start and kind of answer the question, whoever feels most comfortable, and then we'll go from there. So one of the things that comes up when we're talking about resilience is this focus on individual versus organizational resilience. So we've seen a lot of attention on self-care during the pandemic. Should we shift that focus from the individual to the organization? And then if so, how can we go about doing this?
Yeah, my first response is that it needs to be a combination of both, that you wouldn't give up one for the other. The individual is really important, and that we are moving into a world there's a little bit more make to order. It's not the same car for everybody. Some want an air conditioner, some want four-wheel drive, and some want SUV rather than a sedan. However, the organizational side is just as important, and to balance that off. And that's a much, both of them are hard, but they're hard for different reasons. On the organizational side, it's having the policy procedures in place and the thinking. I know there's a question around how do you get leadership on board to think about this? And I think that is if that's a struggle, that needs to be your first priority. And through data, through examples, through sharing success stories, through education and training, if the leadership isn't there, I think you've got a big problem. And that's that organizational piece, but also the individual.
Thanks for that, Greg. Ali or Poppy, do you want to add anything to that?
I can jump in. Yeah, totally agree with what Greg was saying. I think this goes back to something from my presentation. It is both. It's how do we balance individual well-being and business or organizational needs? I have, in our work, I have seen in some cases a shift to exclusive focus on individual well-being and really making that paramount. And I understand where that has come from. So the question is, do we need to shift it? I do think we need to shift it, but it's to become more in balance, not to take away from individual well-being. And having conversations with employees and as a team about our common pursuits. And this goes back to the strategic discipline. What are our common pursuits? How do we work together to achieve those? And also, I think broadening self-care, how do we lift ourselves and lift ourselves to lift others for the benefit of ourselves, but also for the organization. And this isn't just about, I think, what we think of as self-care, but it's about going to some of Poppy's comments. How do we challenge ourselves? How do we grow? Because that is actually good for people. So I think it's thinking, kind of broadening our thoughts about what's important for individual well-being, and then shifting it somewhat more into balance with the organizational needs as well.
I think that's a good point, Ali. So just about, and that echoes what Greg was saying too, right? We need a balance of both, but at times perhaps the shift has been a little more on the individual side. So in that sense, balancing that with the organizational resilience. Poppy?
Yeah, I'll echo Greg and Ali, but add in a little bit, just that we need to stay really aware of the interrelated nature of the organization and the individual when it comes to resilience. because resilience is contextually related. So your resilience is related to the context that you're in, and it is impacted by other contexts. But the way that work functions for somebody is going to directly impact their ability to be resilient, and vice versa. The resilience of staff are going to impact organizational resilience. And so we need to stay aware of the relationship between the two constantly. And I really love what Ali was saying about broadening our perspective of self-care and maybe moving beyond this focus on self-care. Self-care is one component and it's important, but it's also taken on a lot of different definitions and a lot of associations. Resilience is about a much broader skill set, and we need to build this skill set into organizations, leaders, employees. And these skills are related to self-awareness and communication and self-compassion and vulnerability. A lot of what Ali was listing during her presentation, it's not just self-care. And I think we might get more buy-in from leaders if we can move beyond just self-care to a skill set that's transferable to other areas of our work and actually produces results too.
And I just raised one of the other complications for agencies for the organizational is that within the organization, there are many differences by program, and we can't always be equal, but you need to find as much equity as possible. So a residential program versus day treatment versus outpatient program, you know, if we have a barbecue and we have a residential program, a large number of staff can't go. And so how do you deal with that? And in the past, when we don't have residential anymore, when we did have a residential, we actually had 2 barbecues. And we tried to make sure that staff were participating. How do we make sure that most have availability of that? And some of the benefits in that don't help out a certain portion of a program as opposed to another. So really both helping workers understand that there is that difference and that it's not necessarily always equal, but we seek equity as much as possible, input, and how do we ensure that all staff have wellness, but it may be in different ways.
Thanks for that, Greg. And I was just going to comment, there is a comment in the chat around also using different terminology. So there were some organizations that were talking about community care versus self-care, because then you're shifting that from just sometimes the challenge with self-care is that it can feel like it's on to the individual and it's just their responsibility alone. So I like the change in terminology as well. So over the course of the pandemic, how has your approach to building and sustaining resilience shifted, or has it? You know, perhaps for some it's remained the same. So that could be your outlook, Greg, that could be your agency's approach. Poppy, maybe the literature, there's been some emerging needs. So I'd love to hear just thoughts around if this has shifted during the pandemic.
For ourselves, it didn't shift a lot in terms of the importance. We've always had a focus on that and have a number of strategies in place that, you know, mental health days that you can convert from sick leave to a year. We have a staff association. We're not unionized, but we have a staff association that we treat as if they're a union and bring us conditions. I think though what COVID's done, it's made it more complex. It's really created more individualistic. You know, some people in the hybrid model, I have some workers saying they don't really want to work at home at all. They just want to come into the office where they're away from the kids and the dog and everything. And others saying, I wish I could be all at home. And I think what it's pushing at us is really that retrofitting. How do we do that in a way that's, again, fair and equitable across, so that all staff are feeling that they have a sense of value and respect, but it's not always going to be treated exactly the same because their needs are different. That's complex. So I think we've always built that in. I hope people see that in our agency. And we have a good reputation for that, but it's not any easier. It's much harder than it was because of this new world.
Thanks, Greg. So reflecting on some of the kind of new challenges and probably new opportunities too with the pandemic. Poppy or Ali, anything to add?
I can add in a little from a, I guess, higher level, just shifts in the literature from what was happening kind of in the performance space and resilient, like sustained resilience over time, and just what a lot of reports are pointing to now. Something that's really emerged, the list that Ali gave really resonated, like the communication, the transparency, the digital transformations, the idea that not only do we need to learn to adopt our digital work lives, but we need to keep in mind when technology is too much and where to set boundaries. All of those have really come out in the literature, and I'm sure it's because we're reading a lot of the same things, looking at a lot of the same places. But something I've noticed that's come out from a big industry like Microsoft, PricewaterhouseCoopers, is this refocus on self-compassion and this idea that we have a common human experience now, which I don't think existed so much prior to the pandemic, or at least not as, it wasn't as highlighted as much, that leaders are now expected to be on a level playing field in terms of having stressors and having things in their lives that are different because the pandemic changed the course of work. And these reports are showing that employees now expect leaders to show off this common human experience and show that they are having these difficulties and facing these challenges just like their employees. And this at its core is self-compassion work. It's the idea that we're all in this together and we're all experiencing the ups and downs of life in similar ways. And so I think there is a real place for self-compassion work and leaders to kind of take on this perspective that sharing mistake making and the recovery from that and getting back on top is really important for fostering trust and resilience in the organization.
So the pandemic kind of, making our two worlds collide a little more as they've been working from home. And so that, in terms of what staff members and team members are wanting, is just to see leaders acknowledge that, right? And say, I'm here struggling too, or my kids are in the background of the video, or my pets are here. Yeah, you can see that. Ali, anything to add on this?
No, I'm good.
Great. Okay. One of the other pieces, and I know this came up in the chat as well, was just around assessing resilience within your organization. So some folks were saying, they were using Guarding Minds survey, other kind of surveys or assessment tools just to get a sense of how staff members were doing. What would you say are some processes that either, your organization has implemented to assess organizational resilience within your organization, or others that you're aware of? So, it could be surveys, or, is it focus groups? Is it just informal feedback that you're collecting? Any thoughts on this piece?
I can start. I find this question super interesting. I'm really interested to hear what Poppy and Greg have to add. When I think about this question, so back to the pieces that build organizational resilience, the resilient leadership habits that impact your folks and your culture and their engagement, and the strong strategic discipline. So strong strategic discipline would see you having performance metrics of some kind that assess whether you have a healthy organization. So you'll see financial metrics, various financial metrics, employee satisfaction or engagement, ways to measure that. Surveys are the most common. Client or partner satisfaction or engagement. You might have some sort of operational efficiency measures. So if you have that strategic discipline and you've been able to identify these are the indicators that we need to pay attention to that tell us we're a healthy and resilient organization. This comes from, I think, this isn't about resiliency directly. This is about how do we run a great organization? What do we need to be paying attention to? And it's not just, from a for-profit perspective, it's not just the financial metric. It's how are employees doing? Are they happy? Are they satisfied? Are they engaged? Do they feel like they're growing? Do they feel like somebody cares about them? All of those great employee engagement measures. And similarly, how are our partners feeling, our clients feeling about us? And how do we operate efficiently, effectively internally? So from my perspective, if you have those things in place, those are indicators that you have a healthy, resilient organization. So it's not, I have not seen an example of assessing resiliency directly in some specific way. I think that's part of the overall package of what do we pay attention to build a healthy, thriving organization, with the employee engagement or satisfaction piece being a critical part of that. But that might be the piece where you get more direct information around how our employees feeling, doing.
Thanks, Sally. I like that. So just thinking about building it into, maybe there already is an existing survey, for example, that goes out to staff, and like, what are you looking at in there, and how did some of the items probably that you're already, asking staff about and collecting feedback on, how do they relate to resilience versus, having to use a specific tool that assesses organizational resilience, or creating a tool specifically for that. Any thoughts, Greg, in terms of how the Phoenix Center has approached this?
Yeah, so we've used a number of things. Certainly the surveys, either annually or semi-annually. We've used suggestion box where staff have anonymously can put, a thought in or an idea. We've had actual, call for ideas in terms of things that we could do differently or better from staff. Recently, we're starting discussions actually in the last couple of months about kind of kicking that up a notch, that having personal dashboards, for example, and we're going to be working with our staff to say what would tell you that you're doing a good job, what would tell the board, the agency is doing a good job. And I think Ali's right that if you have great outcomes in an organization, you probably have pretty good culture and resilience and supports that are taking place. But I do hear more and more workers asking, especially since COVID, I don't know how I'm doing anymore. I don't have the same, there's just not the same inputs or even the exposure to others. The supervisors on site would see clients coming, hey, you're really busy. Not happening. And the other piece that has come up recently in some consultation with agencies, there's a bit of lack of, what's the word, value of some of the surveys. You get the surveys, but what they really mean. So someone says, yeah, I'm not happy. What does that mean? And it's hard to figure that out. So we're exploring third-party surveying to look at somebody outside the agency where there truly is no connection. It's not your supervisor, it's not the executive director, it's not the HR person who then talks to the leadership. It's somebody that is neutral, that's going to be able to chat with individual workers and to go over a survey or to go through a survey and say, so when you say you're unhappy with your manager, what does that mean? Well, I don't see them very much, versus they're always critical, versus, any other for a while they don't, took Sally out for lunch, didn't take me out for lunch. So, and then not understanding that they want to do that for new workers. So understanding those deeper parts. So we are exploring how to sort of dig a little bit deeper and to how to really create that, not just anonymity, but I've looked at so many surveys and say, gee, it's interesting, but I don't know what it means. I don't understand it doesn't really say what the problem is.
Yeah, so just talking about having that opportunity, having that space, right, for them to then share beyond just a static survey where you don't necessarily get all the context. Yeah, that's interesting to hear.
I can suggest one that I really like is the Gallup Q12 employee engagement survey. There's lots of great research behind it. It's from Gallup, which is a research organization. They have 12 measures that they've identified contribute to employee engagement, which then contributes to productivity, performance, safety, and other great things that we're all looking for in our organizations. And it really speaks to those foundational pieces of, I know what's expected of me at work. I have the tools and resources to do my job, and it's kind of hierarchical. Somebody told me that in the last 7 days, or thanked me or praised me in the last 7 days. I believe my boss cares about me. It's quite research backed, just 12 questions. And what I like about it is you get the survey, but it's not intended to just be a survey. It's intended to create conversation. So you have the survey results, and there's all these resources that then enable the leader to sit down with their team and talk about it. It is anonymous, but if your team's big enough, then you can have a team-based result and say, look, we're not doing well on Q3. If we want to do better, what are we going to do about it? So it opens up conversation. So that's a good one, worth looking into.
Thanks, Allie. Okay, so one of the other pieces, and you've already given, I think, many different tools as we've been chatting and as you were presenting. So folks are wondering, how do you foster positive workplace culture, particularly when team members meet rarely in person nowadays. So we hear a lot about isolation, and this plays into well-being, this plays into resilience. So any specific tools or strategies that you would recommend to improve cultural cohesion, to improve social connection?
I think, first of all, not losing some of the things that we have used in office, regular contact in supervision or management, that someone's, just spending that formal hour, half hour, 45 minutes, whatever it is in their structure, to say, how are things going? What's new? Are you having struggles? Do you have any things that we need to pay attention to? And to give some feedback, both, the positive stuff. And yeah, we noticed that you haven't been attending meetings lately, and let's talk about that. I think the other part is to create some informal pieces. I know about 20 years ago, we created a fun team. And some people call them social network teams, or sort of informal, having party teams or whatever. And we provide dollars to that team, X number of dollars each year. Sometimes changes, somewhat close between 1,000, 2,000 a year. And they have total empowerment to do events and activities. And so we have trivia a day, and sometimes they're in office and before COVID, and now they've been on site. We had a recent, I forget what it was called. There's a program you have these questions come up, and you all compete against each other, and then it scores you. Or we have hockey pools, or we have some of those a get together where people can come for lunch, or have a lunch over internet. Have a 12 to 1 lunch and learn, or lunch and chat. And so those things, I think, are really making sure that you're doing things that still connect people. It's not as good as in person, but it's not as bad as not doing anything.
Thanks, Greg. And just talking about, some of the pieces that we probably already had in place, right? Like most organizations have a social committee or a fund committee already in place, and then continuing to see the benefit of that through this virtual time. And then now, as we're in the hybrid space where we could do some in person, right? Also using those opportunities as well.
I'm going to add something. I think it's important to differentiate between being careful about what we call culture. So when I think of some of the examples around, let's say, social connection and some team cohesion, I think is relevant to some of the kind of tactical suggestions we've talked about. But the culture of an organization is bigger than that, and it's really about the leadership. And what is the culture you create as the habits that you demonstrate as a leader. And then some of those key routines, like Greg mentioned, your one-on-ones with your people, you have to be doing them. Your informal check-ins, you have to be doing them. And some of those things you need to do as a leader to build trust and other positive cultural components. That said, creating team cohesion, social connection, people feeling like they have relationships with each other is also important. You can build it into team meetings in small ways. It doesn't have to be huge. You don't have to have a happy hour every day. It can be in your team meeting. You start with a personal roundtable of some kind, highlight from your weekend. So you can build small things in to create that. Consider occasional in-person. If you're not an in-person organization, it really does matter, and it's different and it's better. So consider what that looks like. Is it twice a year? Is it twice a month? Is it twice a week? I don't know. That depends on your situation, but do consider those opportunities to bring people together, and understand that a lot of people don't want to spend more time on Zoom. So you need to be, I think, judicious in creating social events or activities that people feel obligated to attend. Or feel they may be excluded from something if they choose not to attend, even if you make it optional. So you have to be careful with those things. And is once a month reasonable? Probably. Twice a week? Probably not. I want to get off the computer and go home. So, well, I'm in an office, as you can tell, but so just being careful about that. How can we do it in an inclusive way would be a consideration.
Yeah, thanks, Ellie, for addressing the screen fatigue too, right? Because I know at times I've felt that where we've I know our organization, we're trying hard, we're creating these opportunities, but then it is more screen time just by function of, you know, the pandemic and what we've had to do. So sometimes that can also be, you know, you want the social connection, but it can also be tiring. Any insights, Poppy?
Yeah, I think Greg and Ali have hit the nail on the head with this, but I don't think we can emphasize enough the positive cascading effect of a leader that models the behavior we're striving to see in the hybrid workspace, even when it comes to socializing and lightness and positivity. And that doesn't mean it has to fall on the backs of managers only. Even the kind of informal settings that have come up in the chat and that Greg mentioned, if you have a coffee time or a coffee break where people get together, somebody has to lead that so that everybody else can engage in the comfort and the trust and understand what's going on in that environment, because we are devoid of the regular social cues that we're going to see in in-person environments. And so somebody has to step up and lead and model the behavior for that situation. And that's just part of virtual, but it really can have an amazing effect when somebody is modeling those behaviors, whether it's a resilient behavior, communication norms, social norms, or resilience itself. So that's all I have to add. It really just in line with what Ali and Greg were saying already.
Could I just add that the one thing that was a blind spot for me in the beginning of COVID, paid a lot of attention to the line staff, the direct service staff, the admin staff, and kind of lost the connection to the management staff, and who were working very hard at keeping things going. And sort of, I was not jumping over them in a negative way, but just making sure staff were all okay and not spending enough time focusing on the other leadership in the area. And the second part that we kind of lost track of in the first year of COVID was debriefing, which when it's in person, you kind of see a person is exhausted, is just not themselves. Hey, what's going on? And or you would hear about they had a tough case because they're talking, they're chatting, the coffee room's there. And the virtual, we've lost some of that connection, and making sure that we are trying to keep tabs of that, the personal stress level, and especially if you know there's been something that's been traumatic or difficult, a report they've had to make, or there was a client complaint, that you know that that's going to cause stress, even though it may not be true or it's going to get resolved in some way, to be able to call and have a debrief with that person, say, let's talk about this. How are you feeling? Do you need to connect to somebody? That I think in our agency, we did not do well in the first year of COVID. It got thrown out, not thrown out, but it was blindsided by the other things that are happening. And now we're in the second year. I think we shook ourselves, said, okay, we're missing the boat here. We need to make sure we get back on that. But I think we still get better at it.
Yeah, and thanks for pointing that out, Greg. I think a lot of leaders could relate to that, right? We were kind of course, focused on the service providers. So those we knew exhausted. They were providing these services in a hybrid way or virtually, and then they were also working that way, and then forgetting that, okay, ourselves included, plus other members of, you know, leadership. How do we also support each other and ensure that our well-being and our team cohesion, all those other pieces are where they should be? So I think this flows nicely into our questions from the audience. So one of the questions, and Greg already alluded to it and started to give some pieces around, but one of them is just around how do we actually get leadership buy-in to support initiatives focused on resilience? So there are some organizations we know where it's not regarded as a top priority. Maybe it's kind of, you know, further down on their list of it would be nice to have, but we're focused on, you know, performance. What do we do? So I think, Greg, you mentioned data, like show them the data was one of the recommendations already. Are there others?
I'd love to jump in on this one because in my consulting work, I've spent a lot of years talking about resilience with high performance sport coaches who I think the Q&A actually used the word fluff. Often regard resilience as fluffy stuff. And what we often have to do in order to get buy-in from these environments where stoicism and toughness are really at the forefront, and the idea of resilience as a long-term investment that acknowledges ups and downs and different emotional experiences, it relies on the data, like Greg is saying, and what the research says, which is that more resilience fosters better performance over the long term. While we might have short bouts of good performance, that can't be sustained if we have an unrelenting or a comfortable environment. What we need is a facilitative environment, and that's built through all of these different factors, individual factors, personal qualities, our skills, and what the leaders are contributing back to that environment. So we know that resilience programs, training programs make people work better, understand pressure better, thrive under pressure better. And so if we can present these outcomes to leaders, there's often more of a buy-in, because that's what they'd like to see employees do, is actually thrive in high pressure situations, produce better work over the long term at a sustained quality.
I'm just going to add on 100% what Poppy said, but just depends on sort of the question, the dynamic that you're having this conversation in. But if it's, well, we can't, we need to focus on performance, we need to focus on financial results, whatever it is. It's okay. Well, where does that come from? Like, if that's the response, there's clearly a disconnect. If it needs to be about performance, results, orientation, whatever the language is, absolutely. What builds that? What drives that? And it's all the things Poppy said. It's leadership behavior, it's resiliency, it's sustainability, it's how do we thrive, how do employees thrive, so that we have high performance, so we have results, whether that's financial or client impact or whatever that looks like. And it might be the language of, like, what is it you're trying to put forward? Are you trying to put forward a resiliency program or a individual well-being program, or maybe rethink how you're positioning it, because maybe it's actually about leadership development. Maybe it's about building high performance teams, because we're saying the same things actually, or the actions are the same. So it might be repackaging kind of what you're trying to sell.
Yeah, I would just add, 2 parts. One is one thing that's helped a few times in our agency is having a leader go to another organization where I know there is a program we run very well, or there is something happening that's a new model they've done there, and they go in a third party and they spend a day and talk to people and see things, and they say, oh wow, this staff are happy and they're getting results and there's no behavioral issues in the classroom or whatever. So that's a nice way of finding in your network where agencies are doing well in some areas, and having your staff go into that. The other blunt comment I have that's may not be taken well by some is not all managers are effective managers, and we sometimes are too kind and lenient. And I know in a couple of, I've been in Phoenix Center 42 years and have had some managers that just don't exude the culture, and it is a problem, and it's not a fit. And trying to have a round peg in a square hole sometimes isn't going to work. Training, support, education, trying things out, data, that's all good. But at times it might just be saying, this is not the right person at this time for the culture that we're trying to create in this agency. Very, very difficult. And of course, with Employment Act and so on, it can be very expensive in terms of shifting people out. That's why you want to do it earlier. And your selection of managers and leadership is really critical. We're now moving into doing actually personality inventories of them, looking at their strengths and weaknesses before they come in, looking at identifying in the first 6 months, what do we help to make them ready? And that the culture of the agency is a part of the learning, not just the things, the policy procedures. That's the straight and narrow stuff. It's what builds that, what makes it all work in here. Having a mentor with a strong manager and shadow behind them, and see how they do a supervision, see how they are running a meeting, see how they are performing in a community committee. And this takes time, but the front end time, just like front end time with staff, direct service staff, is worth its weight in gold. It might slow things down in the beginning, but if you orient an onboarded person correctly, it's going to save lots of pain later on. And I think that's something that we sometimes don't pay attention to. And a good line worker does not necessarily make a good manager.
Thanks for that, Greg. And I think actually that was really useful advice, and thinking about it broader than that, just thinking of, these members of leadership, managers are going to be ones modeling the behavior and often implementing, the policies or the processes in place. And so are they a fit, and how important that is that they embody and understand the values of the organization, right? So I think that was a really good point. So one of our other questions that's come up, and I think this was in relation to when Greg was talking about specifically the use of a consultancy firm or a third-party organization that was supporting the surveys. So one of our participants shared that they used a consultancy firm to do an employee engagement survey, but they found the experience was quite stressful and unnecessarily targeted by being a bit of a performance measurement metric for middle management. So it just turned into a real source of stress. So what would be suggested to avoid this, or to ensure that that's not the experience?
I think having the staff participate in the reasoning and what you're trying to do, and in participating in the selection of the company that is going to be doing that, so that everything is transparent and everybody knows that, we're trying this, we're piloting it to see if it makes a difference. If it doesn't make a difference and or is hardship, then we'll do something different. But who's on board to try and make this work, and how do we make it work, and what are the barriers currently to our surveys or to our wellness information? And this is what we're trying. And if something comes up and says, hey, we have a different idea, it's better than that, I would listen to it and say, well, let's try that instead of an external person first and see if that's better.
Thanks. Any other comments?
I'll add a couple of things. So I completely agree with what Greg said, is that upfront framing and communication, helping people understand what it's for, choosing the right provider, which I know can be difficult. So getting referrals or recommendations is probably a helpful way to try to find the right ones, and then having that dialogue around the results with people. I've seen a lot of employee satisfaction or engagement type surveys do a lot more harm than good. Partly for the reason you mentioned, people feel targeted, or people feel that didn't really feel anonymous, and it somehow comes back on them or to them, which is terrible. Or what is probably most common is people feel like they provided input and nothing was done with the information or done about it. So why do you keep asking me? You're not going to do anything anyway. So you do need to be careful. I think the way not to scare yourself out of doing it, I think the way to counteract it is, or mitigate those risks, is what Greg talked about. It's the dialogue. Talk about why you're doing it. It's an experiment. It's new. Let's try this. Really look forward to your engagement, and then sit down and talk about the results and what it means, and do it in an open way. And make sure you're doing it using a program or provider where that people truly feel like it is anonymous, and that they can speak openly, and don't feel like it's somehow being held against them. So there are a lot of factors. I think if you get this biggest thing is in that selection of the tool or the folks that you use, and ask around, try to get some referrals to find something that works for you.
Thanks, Allie. Anything else, Poppy, that you found in the literature?
Directly related to that question, not specifically, but Allie and Greg have been making me think of this idea that a lot of the time we regard resilience training programs as extra work, and it can be a load for leaders to take on. And we talk about surveying and extra metrics that can be even more. But I think Greg alluded to this earlier. A lot can be done with what already exists, as long as it's taken and framed the correct way. And all of this conversation about dialogue is making me think the results of the survey are really interesting for assessing resilience in the organization, but the process of going through the dialogue with staff, getting the survey results, and then debriefing those results is actually in itself creating a skill that contributes to resilience, and that is self-reflection. And it's often the first thing to go, but it's the thing that actually feeds tremendously into sustained resilience, and it's the ability to look back on the processes we're engaging with and the things that we're doing and finding the meaning behind it. Like Greg said, why are we doing this? Why is this meaningful for me? Why did I give that answer? And why is that important for me as an employee, as a worker, as a person? Those are the questions we need to ask in order to start making moves to grow and go to the next step. And often with these surveys, I think that's the piece that's missing. We have the data, we see the data, but there's no conversation that follows that says, okay, and here are the next steps that make us stronger for the next time we have to go through this. Yeah, so there's definitely worth in investing the time into it, and it could potentially hit a lot of different areas of need at the same time.
I just want to magnify what both Ali and Poppy said around there has to be feedback. Surveys, and so often there's surveys taken and you never know what the results are. What's thought about the results, whether anything happened, anything is going to happen. And so going back to saying, here's what we heard on this survey, and here's the 2 or 3 areas that we think we want to do something about, and here's how we're going to move on this with what input and so on. And I think, both Poppy and Ali spoke to that. And I think that's a huge part that if it doesn't happen, actually creates more and more dissonance of the accuracy of surveys, because then I'm just ticking it off. It doesn't matter what I tick, right?
Yeah, that's a good point, Greg, right? Being mindful, going back to being mindful of what you're collecting, what you're going to do with it. So you're not just collecting it for the sake of having this feedback and sharing that back. And I would imagine also inviting feedback around kind of the solutions, having that collaborative approach to addressing those pieces. Okay, so now we're going to move to our wrap up. So we have a few reminders to share with you and just some exciting pieces about what's coming next. Okay, so we've asked that everyone complete the post-session survey. Talking, in the spirit of feedback, we've made it really, really quick, so it won't take you more than 3 minutes. You should get the pop-up for the survey as you leave this Zoom session, and then it will also be emailed out to you for those who registered for the session today. We wanted to also highlight that we do have 2 tip sheets coming out. So beyond these webinars, we wanted something else to be available. We'll have the webinar recordings, and we'll have tip sheets that look at integrating the evidence that's out there, so the published peer-reviewed literature, with, of course, all of these sector insights, all the conversations we've had during the webinars. So we have coming out next month a tip sheet on leading in hybrid workspaces that accompanied our session last month. And then we have the tip sheet that accompanies this session, so focused in on organizational resilience, which will come out in the fall. So stay tuned for those on our website. We also have a future COVID-19 recovery webinar series planned. So we have future topics in September. We're taking a bit of a break for the summer, so we know everyone will be off, hopefully enjoying some holidays or just getting some quiet time in the office. And so we'll be posting information about what those topics are. We'll be posting the registration link as well there. So don't hesitate to reach out in the meantime if you have any questions. And thank you so much, everyone, for joining today. Thanks. Hope you have a great day.